Hello, everybody. Welcome back to MedSynapse podcast. Today we will invade new condition or maybe cosmeceutical approach in dermatology. So I'm so glad to announce about my guest, Dr. Olga. She is dermatologist and nutritionist as well. So welcome back. Welcome, Dr. Olga.
Nice to meet you.
Nice.
Yes, I'm a medical doctor. I'm a dermatologist working in aesthetic medicine, and I have the second type of my work. It is work in nutrition as a preventive medicine. And this helped me to work with my patient more completed, to treat them more completed, and to have better results.
Great. So, Dr. Olga, today we'll talk about very critical point, which is combination and techniques related to stimulation of collagen. So, firstly, I need to know about what is the importance of collagen.
To be honest, the collagen is the main goal of all our cosmetological procedures, because all we want to have skin with good elasticity, with good hydration. We want to have dismissing of some fine line and wrinkles. And without collagen, we will not receive all the results. And with age, we lost some amount of collagen in our skin, and it's not the main problem. Our fibroblasts become more older. We have some special terms about this, but better to say they just become older, and they cannot produce more and more collagen that we need.
Great. So, Dr. Olga, can you elaborate on the concept of combining techniques for enhancing collagen stimulation?
I think if you want to say it shortly, it will be something like less energy from every method for the best results. It means that we use the less amount of energy in every machine technique. We have less risks of some complications. We have less painful procedures, but our combinations give a patient best results from one session. And for us as a specialist, it's less time in our children.
Exactly. So, Dr. Olga, what are the benefits of combining laser resurfacing with microneedling?
I prefer to combine laser resurfacing. I work with combined lasers. It's RIAC lasers which can work fractionally and on the skin surface. It's named Halo. It's a machine from the Cyton company. And I combine these methods with using of some mesotherapy solutions, with using of some revitalization solutions, and with PRP. To be honest, I don't use usually not use exactly microneedling, because when we make fractional lasers, we have some system in our skin to give the solutions inside, because we just make a trauma on our skin and everything is open, and we can just apply all mesotherapy solutions or PRP and have result from two procedures during one procedures.
Great. So, Dr. Olga, how do thread lifts and dermal fillers complement each other?
Okay, when we work with threads, we try to speak about lifting. Maybe it's not very exactly what we do, but we try to make our tissues a little bit upper. But we don't create a huge volume at these procedures, because when we try to make a bigger volume in our face with threads, it means that we make a hypercorrection, and threads are not fixed very well, and patients have not very stable results. Better to work with threads like some collagen stimulator, when we use something like aptars or some polylactic threads, and we just fix tissues, and in the same procedures add some volume in deeper layers. Because when we work with threads, we work in dermal or upper layer of hypodermal, but with fillers we can go deeper. Or, for example, work with some superficial wrinkles or with lips or with nasal drops, because these areas we usually don't touch with threads.
Yes, perfect. I need some left.
Or we can meet in Dubai. It's easier for everyone.
So, Dr. Olga, what are the advantages of non-invasive techniques like radiofrequency and ultrasound for collagen stimulation?
To be honest, I made these procedures for myself, even for myself, because it's give for the patient very natural results. When we work with ultrasound, with HIFU, we stimulate collagen in deep layers, in connective tissues, or we try to compactize to make smaller amount of fat. But with radio frequency, we work with more upper layers, with dermal, with resurfacing of the skin, with wrinkles. And when we did all these procedures in one session, patients have only one period of rehabilitation. We can use not very painful type of energy, type of fluence when we did these procedures, and patients have more visible results. Because sometimes patients expect a little bit more from our procedures that we can give for them. They want to receive the results like from plastic surgery, but in 1 hour in our dermatologic room.
Yes.
And when we combine procedures, we can a little bit increase results and not make rehabilitation very long, or don't create more problems for our patients with this.
Exactly. So, Dr. Olga, how does PRP enhance collagen production?
PRP, it's a very, very big topic of in our dermatologic procedures, because we use not only PRP, we can use plated pure plasma, we can use, for example, plasma with increased level of fibrinogen and so on. There is a very few types of plasma which we can receive for one patient. And when we want to just increase collagen production or increase result from our procedures, it's better to use lighted pure plasma, not rich. Because in such case, we give a patient more collagen, we give the patient more protein, and we give them something from which patient will build their own collagen. It's something like just a structure for all our procedures. But when we use blood-rich plasma, the most common type, we can create a little bit more inflammation, and we can make the rehabilitation a little bit longer. That's why I prefer to use after laser or for example, after microneedling resurfacing, liquid pure plasma.
Great. So, Dr. Olga, how do you, from your clinical experience, how do you tailor treatment combination to individual patient needs and goals?
Everything depends from the patient, because we have our patients are usually very hurried. They have no time for rehabilitation, and to be honest, they don't eat very good because they usually drink a lot of coffee and don't have time for normal lunch or a dinner or something. It means that they don't have very great levels of protein in their blood, and we have not very big amount of sources for producing their own collagen. And in such case, when we work very aggressively, for example, when we use very big energy of lasers, of other procedures, we can create post-treatment pigmentations or very long healing of wounds or some problems for us. That's why I prefer at such type of patients when I understood that they're dysplastic or they're just busy girl who have a lot of sports and not very big amount of food, to use less amount of energy. That's why I combine some machines techniques. Or for example, when I need to use erbium laser, this laser needs water on our skins. In this moment, I combine revitalization with laser because I need to increase amount of water in our tissues, and in that case, laser will work better. Or for example, we understood that patient come to our clinic only for 1 day, and she need to do everything because tomorrow she have flight and she will fly to her home. Because it's a very common situation in our practice now. That's why we need to make something for example, some machines for the face, make another tears drops, make lips augmentations, and for example, work with next with polylactic acid and combine some techniques for her belly, elbows, and something else. Because now patients want to think not only about face and neck, now they understood that they have something more. They want to work with the skin quality on their belly, on their knees, elbows, and really a lot of type of zones.
Yes, yes, exactly. So, Dr. Olga, what are the potential risks and the complication associated with this combined techniques?
The risk that patient tissues don't have enough of energy for normal rehabilitations. That's why we need to speak about preparations for these procedures. I'll prefer to have a very good, rather long type of consultations before prescriptions of some plan or some procedures, because I need to have some blood checks. I need to analyze the patient's complete blood check, level of protein of albumin in the blood, and level of ferritin, because most our patients are women, and we every month we lost some amount of iron. That's why we have usually not very high level of ferritin, and it is very critical for the rehabilitations and for the wound healing. That's why if we check our patient before, we understood that she has a normal amount of protein in her blood, that she is ready for such procedures, we have not very big risk of some complications after. But we need to explain for the patient that she needs to avoid sun, that she needs to use some special diet to increase the protein level in her food, and a little bit decrease the level of her physical activity. I mean that she can use normal physical activity, but not to run marathon 2 days after our procedures. Because in such case, her body will spend all her protein, not for the skin, but for her muscles. And we will have less results. We just need to speak more with the patients.
Yes, exactly. So, Dr. Olga, I'm sorry. What can patients expect in terms of long-term and maintenance related to these techniques in collagen stimulation?
Usually we speak that if they make some really big procedures, they need to repeat it after 1 year or 1.5 years. But between these procedures, we can make something to elongate our results. For example, make PRP, Botox, to make a revitalization, or something for just skin quality. But such big procedures usually we make one time at 1 year or 1.5 years.
Finally, Dr. Olga, I need to discuss with you about the emerging trends in collagen stimulation as its effect totally on patient expectation and requirements as well. So please, what are the emerging trends?
I think the most important trend is personalization. Patients want to create their own plan. They want to understand what they will do during 1 year, 2 years, what the expectations about rather long period, something like 5-10 years. They want to have understanding. Now they don't want to go to the dermatologist and just say, I want more cheekbones, I want more lips. They want to understand what they're doing. And that's why we tried to make the treatment more personalized. We can use some genetic tests, we can make some lab testing before procedures. Even we can use some stem cells therapy or something like this. And that in such cases, patient will receive very natural results, and they will save their identify. They will have their face during all their life. Because I think now patients don't want to be very ideal. They just want to looks good or looks natural, but in their age. Now a lot of patients are very proud that they are 35, 40, 45, that they have some life experience, and that they are not 20 years girls. And they want to look very fresh, very good, but still to be 35 years, 40 years old woman.
And finally, Dr. Olga, I need to thank you so much for being here today, and really it was a very valuable insight, and hope to meet you again in different episodes related to cosmeceutical and cosmetic techniques related to only skin health. Thank you so much, Dr. Olga.
Thank you for invitation.
Thank you. Have a good day.
Have a good day.